Okay, good morning, students. So today mainly in this period, we will be discussing some of the important questions, which I will be showing you all in the slide. So concentrate nicely. Okay, can you see? Yes or no? Can you see the slide?
Yes.
Yes.
Yes, ma'am.
Yes,
Okay.
ma'am.
Okay. These questions are very, very important. Okay, okay, you see nicely. So let us discuss one by one. And after I discuss, okay, I don't know how much, it will be depend on time, okay, how much time we consume, that will be that will tell us to how much question we can cover up for today. Okay, so I'll be reading one by one, then after that once the time ends, then that's all we will discuss for today. And whatever we will be discussing the question today, one day I will be taking the test on this question only, which I'm giving today. So I'll inform you all in advance. So number one, that as discussed. So number one question, all these are very tricky question. Okay, so number one question is, the patient with renal failure should be on which type of diet? Okay, that means a person will have kidney failure. It's here it is not mentioning he have a acute renal failure, he have a chronic renal failure, he have PKD. It's not mentioned anything. It's just mentioned that the patient with renal failure should be on which type of diet. So option number one is high protein, high carbohydrate diet and low calorie. So obviously high protein diet, we never suggest to take the patient high protein diet. Instead, we need to tell the patient not to take the protein, but it should be in the limited, or else it should be in the less amount, isn't it? Yes or no? Or else we need to suggest the patient to have high amount of protein. Okay. So option number A is wrong. And option number B is adequate calorie intake. Means the amount of calorie intake should not be that much maximum. It should be adequate amount. It should be high carbohydrate, which I always used to mention, that carbohydrate jada khane ko bolna hai. And then limited protein. So is option number B correct or wrong? I have already given the answer. You could see in the screen, but still, is the option number B is correct or wrong?
Correct, ma'am.
Yes,
Correct.
okay. Just try to understand, okay. I have already mentioned the correct answer, but you need to know why it is correct, how it is correct, that you need to understand. Just don't simply read the question and then just go and tick, just by heart and just go and tick. Don't do like that. So option C, there will be limited. Here, see option C. See, here is also limited protein, but here what it say, low carbohydrate and adequate calorie intake. So adequate calorie intake was correct, isn't it? Limited protein is also correct, but here they suggest the kidney renal failure patient to take low carbohydrate, which is false. So that is why this cannot be correct. So, and here low calorie, limited. So, and then low calorie, and then limited protein and low carbohydrate. Here also, because we don't need to suggest the renal failure to take less intake of calorie. Okay, instead we have to suggest them calorie लेना लेकिन adequate amount से लेना है, और protein भी लेना लेकिन limited amount में. That is which is why the option number B is correct. All of you are clear, right?
Yes, ma'am.
Yes, ma'am.
Okay, response very nicely. Okay, otherwise I won't give these questions. So what is the normal value of blood urea nitrogen? That is BUN. So the answer is, this is the normal value that you need to by heart. There is nothing to explain in the numerical value. So answer is number B, that is 10 to 20 mg per dl. So if the question comes this, then you need to tick these options, that is option B. So okay, let's move on to number 3. The agent that damage the kidney tissue are called. So let us discuss this. What are the agents that damage the kidney tissue? Okay, all this you need to know. The agent that damage the kidney tissue are called nephron. Obviously, nephron too, it won't be, because what is nephron? Nephron is the array structural and you all don't know what
Functional
unit of kidney. Yes, so obviously that if that is the structure and functional of unit of kidney, then that will not be the agent that will damage the kidney tissue. Okay, so the what is the answer? The answer will be nephrotoxin. Okay, this nephrotoxin, all this we call it as agent. This nephrotoxin, these are the agent, okay, that can damage our kidney tissue. हमारा शरीर पे जो किडनी टिश्यू है ना, वो एक एजेंट डैमेज कर सकता है, तो उस वो एजेंट का नाम है नेफ्रोटॉक्सिन. So don't forget this. So that is the reason why we look option B. एंटीबायोटिक तो obviously नहीं होगा, क्योंकि एंटीबायोटिक क्या था उस दिन डिस्कस किया था. एंटीबायोटिक क्या था? Oh my God.
Infection.
यस, एंटीबायोटिक तो हम इन्फेक्शन के लिए देते हैं, इसका साथ रिलेशन है ही नहीं. So that is why nephrotoxin is the answer. So next, very easy, number 4. Removal of waste from our body is due to the process of हमारा शरीर में any fluid, any waste product, okay, that is being removed. This is due to the process of what? रेस्पिरेशन का वजह से, एक्सक्रीशन का वजह से, एक्सलेशन का वजह से, डबल सर्कुलेशन का वजह से. तो ऑप्शन में दिया है कि ऑप्शन ए. तो ऑब्वियसली एक्सक्रीशन तो सबको पता है, इजंट इट? एक्सक्रीशन मींस व्हाट? टेकिंग आउट, इज नॉट इट? तो रिमूवल ऑफ वेस्ट, जो भी वेस्ट प्रोडक्ट है फ्रॉम आवर बॉडी, इज ड्यू टू द प्रोसेस ऑफ एक्सक्रीशन. सो डू यू एक्सेप्ट द ऑप्शन? डू यू एक्सेप्ट दैट ऑप्शन ए इज करेक्ट? Yes or no?
Yes, ma'am.
Yes, ma'am.
Okay, okay. So many students of you are try to like give the response, all of you. Okay, what is the treatment of choice for patients with end-stage renal disease? मैंने कल ही explain किया था. तो end-stage, तो what is the treatment of choice for patient with end-stage renal disease? तो end-stage renal disease उसका दूसरा नाम क्या था? What is the other name of end-stage renal disease? Why you all used to let me wait? Just say the answer.
chronic renal failure.
Chronic renal disease.
Yes, chronic renal disease. Like so, that is the other name of chronic renal disease ना. तो उसके लिए हेमोडायलाइसिस ही ऑप्शन. तो वो अगर किसी का एंड स्टेज रीनल डिजीज है, माने उसका दोनों किडनी लाइक ऑलरेडी किडनी में उसका पूरा डैमेज हो गया ना, एंड स्टेज किडनी क्रॉनिक हो गया ना, तो मैंने एक ट्रीटमेंट बताया था. तो yesterday we have discussed also. So the options are hemodialysis, kidney transplant, continuous renal replacement therapy, peritoneal dialysis. तो मैंने दिया option B, that is kidney transplant. So is kidney transplant the treatment of choice for patient with end-stage renal disease? Is it correct or false?
Yes, ma'am.
Correct, ma'am.
Correct.
Yes, ma'am.
Correct,
Yes.
ma'am.
Yes, okay, very good. Okay. Okay, so all of you, are you clear with these 5 questions? 1, 2, 3, 4, 5. Anyone want to ask me any questions?
Yes, ma'am.
Okay, okay, shall we move on?
No.
ma'am.
Okay, okay.
Yes.
Yes, ma'am.
Ma'am.
Okay,
Yes, ma'am.
okay. So number 6. This is number 6. When the kidney cannot effectively regulate fluid and electrolyte balance and eliminate metabolic waste product, intake of this, wait, okay, my net connection. Can you hear me? Can you hear me, student? Student, can you hear me?
Yes, ma'am.
Yes, ma'am.
Oh, it was written suddenly network low. So, okay. When the kidney cannot effectively regulate fluid and electrolyte.
Yes, ma'am.
Okay, okay. Okay, numbers, let us discuss number 6, okay? In number 6, when the kidney cannot effectively regulate fluid and electrolyte balance and eliminate metabolic waste product, intake of this substance must be regulated. Fluid and sodium intake are limited. So, इस क्वेश्चन का मतलब क्या है? when the kidney, हमारा जो kidney है ना, when the kidney it cannot effectively regulate fluid and electrolyte balance, okay, balance and eliminate metabolic waste product. So intake of this substance must be regulated. So fluid and sodium intake तो when हमारा kidney जब effectively fluid और electrolyte balance को effectively regulate नहीं कर पाते या फिर like वो metabolic waste product है ना वो eliminate नहीं कर पाते तो हमको क्या करना चाहिए और फ्लूइड और जो सोडियम इंटेक है ना उसको हम लिमिटेड करना है बिकॉज ऑल द वेस्ट प्रोडक्ट ऑल द मेटाबॉलिक वेस्ट प्रोडक्ट वो सब हमारे शरीर पे जमा हो रहा है ना क्योंकि हमारा किडनी इफेक्टिवली वो फ्लूइड वो इलेक्ट्रोलाइट वो जो जमा हो रहा है हमारा शरीर पे वो किडनी फेलियर का वजह से वो हमारा शरीर पे मींस इंस्टेड ऑफ गोइंग अवे instead of like excreting away from our body, instead it remain, isn't it? That is the reason why we have to limit the intake of fluid and sodium in our body. So that is why हमको like option B choose करना पड़ेगा as an answer. So यहाँ पे नंबर ऑप्शन ए में encourage बोला तो अगर किडनी फेलियर है किसी का और वो शरीर पे like वो फ्लूइड इलेक्ट्रोलाइट इम्बैलेंस हो रहा है उसको वेस्ट प्रोडक्ट एलिमिनेट ही नहीं कर पा रहा है तो हम उसको बिल्कुल भी एनकरेज नहीं करना चाहिए कि और फ्लूइड और सोडियम लेना फ्लूइड और भी ज्यादा लेना सोडियम भी और भी ज्यादा लेना ऐसा बोल के एनकरेज नहीं करना है आर यू क्लियर Are you clear?
Yes, ma'am.
Okay.
Yes, ma'am.
That is the reason why we have choose option B. Okay, let's move on to number 7. So what diagnostic tests would be monitored to evaluate glomerular filtration rate and renal function? So ये अच्छी तरह ये question पढ़ना, okay? What diagnostic tests would be monitored to evaluate glomerular filtration rate and renal function? So यहाँ पे बोला है what type of diagnostic test, okay, you will monitor in order to evaluate the GFR and renal function. तो इसमें आंसर होगा serum creatinine and BUN, that is blood urea nitrogen. So this is the answer. So you can like by heart this, okay? Urinalysis भी है, urine test करके किडनी बायोप्सी भी तो टिश्यू निकल के जो चेक करता है और क्रिएटिनिन क्लियरेंस all this. But the answer is serum creatinine and BUN. So the serum creatinine or BUN, this is the diagnostic test that you would monitor, okay, or in order to evaluate GFR rate and renal function. Renal माने ये GFR का जो रेट है और renal function है वो evaluate करने के लिए उसका function evaluate करने के लिए you have to perform the diagnostic test and that is serum creatinine and BUN. So that is about number 7 and coming to the number 8. So number 8 may impair blood supply to the kidney can cause what? What is the answer? Pre-renal, okay? There is intrarenal also, pros-renal also, peri-renal is also there. But the answer is option A. तो impair blood supply to the kidney. जो हमारा kidney में blood supply होता है, हाँ? तो अगर जो blood supply होता है उसमें impair हुआ, okay? So impair होने से blood supply to the kidney impaired होने से क्या होगा? That can cause this pre-renal failure. Okay, that is number 8 answer. Are you clear? Yes or no?
Yes, ma'am.
Yes, ma'am.
Okay. Next. DAS failure. Okay, DAS failure is caused by obstruction of urine flow. That is urethral obstruction by enlarged prostate or tumor, urethral or kidney pelvis obstruction by calculi. तो यहाँ पे क्या होता है? DAS failure is caused by obstruction of urine flow. क्या renal failure है जो obstruction urine flow obstruction का वजह से होता है? That is the answer is post renal. Okay, post renal failure is caused by obstruction of urine flow. जब urine flow में obstruction होगा और तब क्या होगा? There will be like post renal failure. So that is option number C is the correct answer. So what is the last one? Number 10. What are the symptoms of what are the symptoms of suffering from kidney disease? So what are the symptoms of suffering from kidney disease? तो मैंने बहुत ज्यादा एक्सप्लेन किया ना, क्योंकि मैंने कॉन्सेप्ट ऑफ रीनल डिजीज में जितना भी एक्सप्लेन किया तो उसमें लाइक हर चैप्टर्स में यू विल इन हर चैप्टर में दिखाई देगा, हाँ हर चैप्टर्स में दिखाई देगा कि उसमें हाई बीपी होता है, उसका रेस्पिरेटरी प्रॉब्लम होता है, उसका स्वेलिंग ऑफ फेस लेग एक्सेट्रा होता है। इसलिए ऑप्शन मैंने दिया है ऑप्शन डी, दैट इज ऑल ऑफ द अबव। तो इज द ऑप्शन दैट आई हैव गिवन करेक्ट और रॉन्ग?
Yes.
Yes,
Correct
ma'am.
or wrong?
Correct, ma'am.
Okay, okay.
Yes, ma'am.
Correct, ma'am.
Okay, because in the question na, it is not mentioning na. So tell me the symptoms of acute renal failure. Tell me the symptoms of chronic renal failure. Tell me the symptoms of PKD. It's not mentioning like that. It's mentioning that if a person suffer from any kind of kidney disease, so what type of symptoms he will produce? That is, he will have high BP, he will have respiratory problem, that is SOB, difficulty in breathing, whatever, so many things. And then he will have edema, that is swelling in face, leg. That is the reason why this is all of the above. So till now we have discussed 10 questions. Are you clear, all of you? 1 to 10?
Yes, ma'am.
Okay,
Yes,
let's move on.
Yes, ma'am.
Okay, let's move on. Number 11. Number 11, okay? ये अच्छी तरह सुनो, ये number 11. When the kidney have few nephron, थोड़ा सा nephron, to excrete metabolic waste and regulate fluid and electrolyte balance adequately, the patient is said to have. तो मैंने क्या ऑप्शन दिया? End stage of renal disease, renal insufficiency, acute tubular necrosis, dialysis. तो उसका क्वेश्चन को समझने का कोशिश करो पहले. When the kidney, जब kidney, that is the structural and functional unit of kidney, that is nephron ना. When the kidney have to, हमारा kidney means when the kidney have थोड़ा सा nephron, हमारा जो kidney है ना अभी like इतना खराब हो गया कि हमारा kidney इतना खराब हो गया कि उसका सिर्फ थोड़ा सा ही nephron बचा है. Okay? थोड़ा सा ही नेफ्रॉन बचा है इन ऑर्डर टू एक्सक्रीट जो भी वेस्ट प्रोडक्ट है, मेटाबॉलिक वेस्ट एज वेल एज फ्लूइड और इलेक्ट्रोलाइट बैलेंस करने, फ्लूइड एंड इलेक्ट्रोलाइट बैलेंस को रेगुलेट करने, एडिक्वेटली रेगुलेट करने के लिए भी उसका जो नेफ्रॉन है वो बहुत कम है. तो अगर ऐसा होने से दैट पेशेंट इज सेड टू हैव व्हाट टाइप ऑफ डिजीज? So I gave end stage of renal disease because end stage of renal disease means both the kidney already failed. Isn't it? Your kidney is so damaged, so damaged, so damaged. Your kidney is so damaged that you have only a few amount of nephron present in your kidney, okay, in order to excrete the metabolic waste and regulate the fluid and electrolyte balance adequately. That is why if a person have this kind of like insufficiency, then that kind of patient is said to have end stage renal disease. Are you clear with number 11 point?
Yes, ma'am.
All of you? All of you?
Yes, ma'am.
Yes, ma'am.
Okay, if you have doubts, please ask me on the spot. मैम ये वाला क्वेश्चन के लिए ये वाला आंसर क्यों है, ये ऑप्शन ए क्यों है, ऑप्शन बी क्यों नहीं है, ऐसा कुछ भी क्वेश्चन होने से you are most welcome to ask me. Number 12, which kidney disease is known to be inherited? So inherited के लिए कौन सा वाला kidney disease? end stage renal disease ये तो बिल्कुल भी नहीं है, protein disease ये भी तो बिल्कुल भी नहीं है inherited का, autoimmune kidney disease ये भी नहीं है. The polycystic kidney disease, this is the like inherited that renal disease, it's like kidney disease that I have given you, because under the polycystic kidney disease you got the types, it's not it, you got the types, you got the two types. So those are the those type are the inherited. So that is the reason why this option D is the correct answer, that is the inherited. Okay, coming to the number 13, the leading cause of kidney failure is, तो मैंने कल ही एक्सप्लेन किया था कि बहुत सारा causes हो सकता है, लेकिन कुछ causes होता है जो बहुत कॉमन होता है. Yesterday I explained that there are so many causes that we will find for the kidney failure, but there are some of the main common causes. तो मैंने कल क्या क्या बोला था? What did I say yesterday? जो common causes है, मैंने एक बोला था. मैंने एक तो हाइपरटेंशन भी बोला था और दूसरा वाला क्या बोला था cause? What did I say?
Diabetes mellitus.
Yes, diabetes. Okay. So diabetes. Diabetes is the leading cause of kidney failure. Yesterday I explained it's not it. Even that day I told you all the normal value of this high blood pressure and 70 to 140 mg per dl. So if a person's sugar level is very high, that means if he have diabetes mellitus, so he have a great chances of developing this kidney failure. So never forget this. So here diabetes is also can be because of infection, also injury, smoking also. Means if you see the option now, it is like almost ये भी smoking का भी हो सकता है. You can have that thought. लेकिन हमेशा question अच्छी तरह पढ़ना. Here in the question it is not mentioning that which is the one. It's not mentioning like that. It's mentioning the leading cause. जो बहुत ज़्यादा common वाला cause. So if this question come, don't get confused. Are you clear with number 13? Number 13, are you clear?
Yes, ma'am.
Oh, okay, so number 14. सबसे easy. Name the excretory unit in the human excretory system. So neuron. Name the excretory unit bola in the human excretory system. So option number 1, neuron. Next is nephron. Next is nephridia, and one is nerve. So the answer is B, that is nephron. Okay. And then number 15. Where kidney are present in the human body? Ito, तुम लोग anatomy, applied physiology में पढ़ के like you are fed up, I think. So हमारा जो kidney है, where it is present, where it is located. So can you please tell me, even though the option is given? Is our kidney present in front of our chest? Yes or no?
No, ma'am.
तो हमारा किडनी कहाँ पे, हमारा शरीर पे ये हमारा जो 2 किडनी है कहाँ पे दिखाई देता है?
At the back.
Yes, at the back. Okay, just below the waist. So यहाँ पे 1A B C D 4 ऑप्शन दिया, तो कौन सा वाला ऑप्शन चूज करोगी?
A.
Yes, very good. Option A. Okay, now till now we have discussed from question number 1 to question number 15. So are you clear?
Yes,
Yes, ma'am.
Yes, ma'am.
Okay. Okay, these questions are very important. Okay, let's move on. Okay, next 16, 17, 18, 19, 20. Okay, let us discuss again. So which of the following is not a feature of the nephrotic syndrome? So यहाँ पे which of the following, okay, which of the following is not a feature of the nephrotic syndrome? So number 1 is proteinuria greater than 5 gram per day, hypercholesterolemia, microscopic hematuria, and peripheral edema. So इसमें मैंने दिया है option C. So option C is is not the feature of nephrotic syndrome. So is proteinuria greater than 5 gram per day the feature of nephrotic syndrome? See this, I have given A, B, C, D, okay, and I have said that microscopic hematuria is not the feature of nephrotic syndrome. So if it is like that, then you check option number A, option number B, and option number D. These 3 are like correct or not. You check it. Proteinuria, nephrotic syndrome में मैंने explain किया था. Srijana, can you please take attendance? Like it's only 10 minutes left. Say fast. प्रोटीन्यूरिया होता था क्या नेफ्रोटिक सिंड्रोम पेशेंट में? अरे मेरे डेफिनेशन में ही तो दिया है, इसका एडिमा होता था, प्रोटीन्यूरिया भी तो होता था,
Yes, ma'am.
और हाइपर
Yes, ma'am.
कोलेस्टेरोमिया, तो उसका कोलेस्ट्रॉल लेवल ये सब भी लाइक वो होगा, हाइपर होगा. तो दिस इज द, इफ दिस क्वेश्चन कम्स you have to choose option number C. So, and in order to choose option number C, you have to read the question nicely, okay? So don't read the question like this. Which of the following is a feature of nephrotic syndrome? तो ये छोटा सा ये जो not लिखा है ना, not, that means which of the following is not. तो कौन सा वाला है जो nephrotic syndrome का feature में नहीं आता है? तो you have to choose this. So next, coming to the number 7. So what is number 7? Which of the following is the modality of choice for detecting renal stone? So this was taught to you by your Shaban man. So renal stone. So which of the following is the modality of choice for detecting renal choice? So कौन सा वाला है, कौन सा वाला modality of choice है जो हम renal stone को detect करेंगे? So the option is CT scan. Okay, CT scan is the modality of choice for detecting renal stone. तो CT scan करने से like जल्दी जल्दी detect करके पता चल जाता है. So don't get confused. If the question come ultrasound, Doppler ultrasound, CT scanning, MRI, then you choose the answer CT scan. Are you clear? Yes or no?
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. Next, let us see. Okay, which of the following statement is correct? Question अच्छी तरह पढ़ना. कौन सा statement correct है? तो यहाँ पे raised jugular venous pressure is a reliable marker of fluid overload, which is totally wrong. And here high blood pressure indicate increased total body sodium. ये तो बिल्कुल भी नहीं है. Increased total body sodium usually cause high blood pressure. तो increased total body sodium, तो हमारा शरीर पे जब सोडियम लेवल बहुत ज्यादा increase होता है, तो is that the cause of high blood pressure? So that is totally wrong. And then here sleeping in a chair worsen leg edema. So this is true, okay? Because क्या होता है कि like किसी का edema हो रहा है, OEDEME is similar with that of edema. Don't get confused कि edema का spelling तो EDEM में था, तो OEDM में क्या है? Don't get confused. This is same, totally same. So sleeping in a chair worsen leg edema. तो हमारा जो edema है ना, like I think already discussed by your other ma'am also. तो जब leg पे जब edema होता है ना, and then when you sleep in a chair, okay, when you sleep in a chair, it get worsen. So और भी ज्यादा वो है, जो एडिमा है ना, जो फूला है और भी ज्यादा फूल जाता है जब हम चेयर पे सोते हैं. तो that is the answer. So that is the correct statement that you need to choose. So Srijana, are you taking attendance?
Yes, ma'am.
Okay. So the number 19 question. So the most commonest microorganism, nearly 80% in UTI is. मैं जो इतना explain किया था वो क्या था? इतना common microorganism क्या था जो nearly 80% in UTI, urinary tract infection में होता था? कौन सी organism था? Tell me. मैं उसका full form भी हमेशा बोलने को
E. coli.
E. coli.
Yes, very good. E. coli. So E. coli is the most commonest microorganism, okay? Nearly 80% in UTI. तो UTI जो urinary tract infection है ना, हमारा means शरीर पे जब urinary tract infection होता है, तो ये mainly because of E. coli microorganism. That is why in the question it is mentioned 80%. So बहुत सारा microorganism, बहुत सारा bacteria हो सकता है, but out of all those, E. coli is the most common. So that is why option C is the correct answer. So coming to the number 20, there is a doctor who is specialized in kidney disease is called. तो अगर किडनी डिजीज के लिए डॉक्टर, उसमें किडनी में डॉक्टर का स्पेशलाइजेशन है, तो that doctor is called what? That doctor is mainly called as what? He is called nephrologist, okay? Nephrologist. So a doctor who is specialized in kidney disease is called nephrologist. Or can I ask you like a person who is a doctor who is specialized in specialize in skin disease is called what? In skin disease is called what?
Dermatologist.
Yes, dermatologist. Very good, dermatologist. And a doctor who is specialized in eye disease is called what?
Ophthalmologist, ma'am.
Yes, very good. Okay.
Ophthalmologist, ma'am.
Okay, very good. Okay. These are the 20 important questions that we could discuss today. So all of you are clear with all from number 1 to number 20 questions?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay,
Yes, ma'am.
Okay, I will be sending this 20 question, okay, to you all, like in PDF I will be sending. So please study nicely this 20 question, and one day, whenever I have got time, I will be taking this oral test on this. I won't prepare question. We'll have face-to-face test, online test. We will have on this 20 question. मैं question तो पहले advance दे दूंगी और उसमें ही मैं पूछूंगी the 20 questions. So prepare nicely, okay?
Okay, ma'am.
Excuse me. Okay, now we will be ending for this class, first class. So after a minute, I will send I will send you all message that when you need to join again, okay? Is it okay?
Ma'am.
Okay, ma'am.
Okay, ma'am.
Okay, thank you everyone.
Thank you, ma'am.
Thank you, ma'am.